Finish. The next comment is on matter, Senator Lynn, you have 4 minutes.
Thank you, Cahirlock, and thank you, Minister. I want to acknowledge that Minister Naughton did contact me yesterday to say she wouldn't be available today, which I thank her for, and has obviously agreed to engage further on the matter, but thank you for being here today to take it. Over the last few months, we've obviously seen a very high rate of overdose due to heroin with a synthetic with synthetics in it, synthetic opioids, and obviously, you know, we often don't think of how the globe is so connected in this sense. When we look at the Taliban reducing the opioid and poppy cultivation by 95%, and most people will see, oh, that's a great thing, isn't it? You know, we're reducing the amount of opium coming out of a country and going around the world. But what happens is then it leaves a hole, because people will create synthetic style drugs that we're not probably yet ready to respond to or catch up with. So everything does have a consequence, and unfortunately in the last few months we've seen what that consequence is, because we have seen what we know, 40+ deaths. That doesn't mean that there is not more than that haven't been captured adequately in terms of the overdose. And this is on top of already 1 person a day dying from overdose. Not all opioid overdose, but the ones that are opioid overdose are preventable with naloxone. In Ireland, naloxone is on prescription. There is no need, Minister, for naloxone to be on prescription. It's not a drug that can be abused. The only risk with having complete access to naloxone is that somebody thinks that someone is in an overdose and brings them around, and that person goes into withdrawal. But when you measure that small risk of being maybe overly cautious with the use of naloxone, the alternative is death. We should have naloxone free access in chemists. Currently, pharmacists don't seem to also understand how it's being prescribed. There's now a box ticked on prescribing doctors who can prescribe naloxone. Lots of doctors who prescribe naloxone are getting called from pharmacies about this new aspect of the prescription. So maybe there needs to be a campaign with pharmacies to understand this new box that's on this prescription in relation to naloxone. My fear, Minister, is that if we don't make naloxone accessible, we just continue to watch people die unnecessarily. We should be able to have naloxone in our homes. I think the HSE done a very good job in getting the message out over the last few months. I know for me, you know, I have to text people that I love very much and ask them not to buy not to buy heroin because there is a bad batch. And when somebody is in that situation, they'll often still take that risk because they are in such bad withdrawal, or they have no other options, or they've no way to know. And so many families don't know, first of all, that there's access to naloxone, and the individual who's using heroin is the one that gets prescribed naloxone, and that doesn't seem to be really make sense when they're not going to be the ones that respond to their own overdose. We should be able to go into a chemist, get naloxone, have it in our homes, have it in our community organisations, and then also look outside of Dublin, where we not only have, I suppose, barriers to naloxone, but what we also have is up to 12 months in some counties waiting lists for opioid substitute replacement, which will also bring down overdose over time if people are moving from heroin to a more managed maintenance programme. One more point I'd like to bring up is in the prison system. So what reports are coming to me from the prison system from some of the lads is that they're trained in overdose prevention, but they don't actually have access to naloxone. In the likes of even the JFK Museum in Boston, there's a little fire, you know, like them little shatter, them glass boxes that you shatter with a hammer and you take the naloxone out. Even in the museum they have naloxone. In the prison system, some of the men sometimes are afraid to alert the authorities of the prison that there's a potential overdose because they feel punishment may come, raids on their cells may come, and they may wait too long before they alert someone. Where we have the Red Cross in there training people as listeners, training people to have overdose prevention, where they could also be tasked then to have peer-to-peer access to naloxone if something does happen on a landing, and maybe it can be in like that box that is in the likes of the JFK Museum and other places in America. Thank you.
And before I bring in the Minister, could I welcome to the Visitors Gallery St Anne's School in Tipperary. You're most welcome, and as is the rule but not written down rule of Seanad, and obviously there'll be no homework, hopefully, until, I suppose, 2024, if that's agreeable by the House. Could I now bring on the Minister?
And thank you, Senator Ruane, and I'm glad that Minister Naughton had the opportunity to speak with you directly, but just to be able to update senators more broadly, and I know she will do further work. As the Senator has said, naloxone is a prescription-only drug at the moment. Measures have been put in place to ensure as many people as possible are required to have access to naloxone administration courses. The Department of Health and the HSE are acutely aware of the dangers of all drugs, especially synthetic opioids, and they're working in collaboration with European partners to try to prepare responses to new opioids or other drugs that may emerge. The emergence of synthetic opioids is being monitored closely by the EU Drugs Agency. Ireland supports that mechanism through the Early Warning and Emerging Trends Network, which has representatives from the Department of Health, Justice and Garda Síochána, Prison Service, the Health Research Board, the HSE, several national laboratories and civil society representatives. Naloxone is used as an antidote to reverse the effects of an opioid drug like heroin, morphine and methadone if someone overdoses, and it is a lifesaver drug, as you have said. Over 1,900 people have been trained in overdose awareness and naloxone administration by HSE and partner services, and 6,488 units of naloxone have been supplied by the HSE to services. It can be used in emergency situations without prescription, but of course the barrier is that the person administering the product must have been issued with a certificate stating that he or she has satisfactorily completed a course of training. As you've pointed out, there are many situations where that's actually happening, but perhaps access to the drug is more restricted. We know that during the recent spike in overdose cases in Dublin and Cork in particular, that naloxone has saved lives. In many cases it was administered before emergency services arrived on the scene, and Minister Naughton is really keen to ensure that it is more readily available. The question is, what is the pathway for that and how is that going to be done? I understand from Minister that work is underway by Minister Naughton and her officials to ensure that Gardaí, for example, are trained to use naloxone and are carrying naloxone while on the beat. Separately, Minister Naughton is keen that it is more readily available to people helping those in addiction, including support workers, peers and family members, and she is exploring ways in which to make it entirely prescription-free and to see how that might work and what the practicalities of that are. I might allow the Senator to respond if there's any.
Thank you. I think it's good to hear that the Minister is exploring how to make naloxone prescription free, and I understand that training is necessary, but also in an emergency situation it's much like an EpiPen. I mean, you're going to, and there's obviously nasal naloxone as well, which is even a much easier option in terms of a shot, straight up the nose. So I definitely think there's loads of options. And also to be able to empower community leaders. We do see communities being trained on suicide prevention and how to respond in that community. Like if a GP was able to freely or if you were able to access naloxone in a chemist, you can attach some sort of, mini kind of training to particular chemists or particular doctors that, give insight to family members that in case of an emergency, if a trained person is not around, this is what is expected of you. The drug, in terms of training, obviously is important, but it's not a drug that's going to cause any harm other than bring someone around. So I am glad to hear that they are looking at ways for it to become prescription free, and also hopefully we can communicate between the Minister and the prisons to see how we can make it more accessible within the prison systems. When you walk into Mountjoy at the moment, there's a big sign for naloxone in terms of promoting, because obviously when you leave prison you're more susceptible to overdose anyway in those first few weeks because you haven't had the same access to maybe an opioid, but yet that you can't access naloxone in the prison. So I might then just maybe follow up with the Minister on the prison point specifically, and it may be the Department of Justice as well that might need to comment on that one. Thank you.
Yes, thank you. And I know the Prison Service has been working with HSE Addiction Services on this for some time. It is a hugely beneficial project. It benefits both people in prison and their families. There is a significant training for pharmacists on naloxone administration ongoing. There is a body of work on this, but it is, the government recognises that this is a life-saving drug. It's clear the response that it can have on somebody's life and on their well-being, notwithstanding that it is currently a prescription drug and that there are restrictions there. It is the express intention to try to make it as broadly available as possible with the intention of saving lives.
Thank you.